The Medicaid program promises to care for our most vulnerable, but right now New York is defaulting on its promise.
Nursing home residents in the state of New York are primarily under Medicaid.
About 75% of our resident population is on Medicaid, and the shortfall is significant.
The Medicaid rate doesn't cover the cost of care. We're approximately $150 short every day on a Medicaid resident. Without the proper reimbursement and adequate funding, we're not able to provide the quality care that our residents deserve.
The last few years, running any long-term care facility has been extraordinarily challenging.
It is really very difficult for healthcare facilities like us to maintain the level of care that we want to provide and keep up with the increasing cost. Our workforce is the most important asset that we have in our facility.
A day doesn't go by that we're not talking about the need to increase salary or benefits.
The major increase in costs that we have seen is in staffing. Ever since the pandemic, it's been very challenging to attract and retain staff.
We aren't able to even open the beds that we have available.
We've had to limit admissions at times.
Residents are being held up in hospitals longer because there isn't a suitable place, quality facilities to help care for individuals. We all have empty beds. We all have empty beds because we don't have enough staffing. Increase in cost of labor, open beds, it's not good math.
Every day we see more people enter their senior years. We're taking care of people that are much more frail, have multiple chronic conditions, require much more care than they used to in the past.
Fort Hudson provides services across 10,000 square miles across all of its programs. Without nursing homes in the community, they don't get those services, or worse yet, they have to travel many miles away from their home communities to receive the care they need. The Medicaid system hasn't been properly funded and certainly hasn't been restructured in over 15 years.
Medicaid funding is key, and now it's caught up with us.
It is very alarming to kind of think of what the future is going to be like for us in 5-10 years with not having the appropriate Medicaid funding.
Older New Yorkers and anyone in need of around-the-clock nursing care deserve access to quality care close to home and their loved ones. It's time for New York's policymakers to reform and rationalize the nursing home Medicaid system. Please fulfill your promise to older adults and ensure that Medicaid reimbursement matches the real cost of providing care for all New Yorkers.